Before you memorize a single drug name or solve your first pharmacy question, there is one mistake that causes thousands of pharmacy technician exam candidates to lose easy points. Even worse, in a real pharmacy, making this mistake could lead to serious legal consequences, patient harm, or even the loss of a professional license. The surprising part, most people focus on medications first, but the PTCE expects you to understand the laws that control every prescription before a single pill is ever counted. If you can master these rules, you'll answer many exam questions with confidence and understand why pharmacies operate the way they do. And here's something that will make studying much easier. We've put together a free PTCB Pharmacy Technician Study Guide with the most important exam questions and key concepts. You can download it from the link in the description and use it while following along with this course. Now, welcome to the PTCB Pharmacy Technician Study Guide. In this first section, we're building the foundation that everything else depends on. You'll learn the federal laws, regulations, and pharmacy rules that every pharmacy technician must understand for the PTCE and for working safely in a real pharmacy. By the end of this lesson, you'll clearly understand what pharmacy technicians are allowed to do, what responsibilities belong only to the pharmacist, and how these laws help protect patients every single day. Let's get started and build the knowledge that every successful pharmacy technician needs. We will start with a law you will hear about every single day, which is called HIPAA. This stands for the Health Insurance Portability and Accountability Act. The main purpose of this law is to keep patient medical records private and secure. As a pharmacy tech, you're never allowed to share a patient's health information with anyone who does not need to know it. This means you cannot talk about what medications your neighbor picks up, even with your own family. For your exam, you need to remember that HIPAA violations carry very heavy fines. Even throwing a prescription label in a regular trash can is a violation of this law. You must always use special shredding bins for anything that has a patient's name, address, or medication on it. Protecting privacy is a huge part of your daily job, so the exam will definitely test you on how to handle trash and paperwork. Next, we need to talk about the Food and Drug Administration, mostly known as the FDA. The FDA is the government agency that makes sure all food and medicine in the country are safe to use. Before a new drug can be sold in a pharmacy, the FDA must test it and approve it. They also have the power to recall a medication if they find out it is making people sick. Another very important agency is the Drug Enforcement Administration, or the D. The D only focuses on controlled substances, which are drugs that have a high risk of addiction or abuse. If a pharmacy wants to sell these strong medications, they must register with the D and get a special license. You will see D numbers on prescriptions for things like strong pain pills and ADHD medications. The rules the D enforces come from the Controlled Substances Act. This law divides addictive drugs into 5 different categories, which we call schedules. Schedule 1 drugs have the highest risk of abuse and are not used for medical reasons at all. Examples of Schedule 1 drugs include heroin and illegal street drugs, so you will never see them in a normal pharmacy. Schedule 2 drugs are very strong medications that we do use in healthcare, but they have strict rules. These include strong pain medications like oxycodone and fentanyl. Because these are highly addictive, patients must have a physical, signed prescription from their doctor, or the doctor must send it through a highly secure computer system. A doctor cannot just call the pharmacy on the phone and ask for a Schedule 2 drug. Schedules 3, 4, and 5 contain drugs with a lower risk of addiction compared to Schedule 2. These include things like sleeping pills, anti-anxiety medications, and some cough syrups. The rules for these are a little more relaxed, so a doctor is allowed to call these prescriptions in over the phone. Patients can also get refills on these medications for up to 6 months, which they cannot do with Schedule 2 drugs. To keep track of all these strong drugs, pharmacies have to use special paperwork. If the pharmacy needs to order more Schedule 2 drugs from a supplier, the pharmacist must fill out a D Form 222. This form is strictly tracked by the government, and losing one is a very big deal. On your exam, remember that D Form 222 is only used for ordering Schedule 2 medications. Sometimes, things go wrong, and a pharmacy might lose some controlled substances or have them stolen. When this happens, the pharmacist must immediately report it to the government using a D Form 106. This is an easy exam question to get right if you remember that 106 equals theft or loss. Keeping exact counts of these pills is a daily task to make sure nothing goes missing. Let us move on to another big law called OBRA 90, which stands for the Omnibus Budget Reconciliation Act of 1990. This law completely changed how pharmacists interact with patients. It says that the pharmacist must offer to talk to every patient who gets a new medication. This conversation is called counseling, and it helps the patient understand how to take their drug safely. OBRA 90 is very important for pharmacy technicians because of what it does not allow you to do. As a tech, you are never allowed to counsel a patient or answer questions about how a drug works. If a patient asks you if they should take their pill with food, you must ask the pharmacist to come talk to them. Your job is to process the order, while the pharmacist handles the medical advice. Next is the Poison Prevention Packaging Act, which helps protect small children from accidental poisoning. This law requires that most prescription drugs be put in bottles with child-resistant caps. These are the tricky lids that you have to push down and turn at the same time to open. The goal is to make it very hard for a young child to open the medicine bottle by themselves. There are a few exceptions to the child-resistant cap rule that you should know for your test. A patient can ask the pharmacy to use easy open caps if they have arthritis and cannot open normal bottles. Also, some heart medications, like nitroglycerin, must always be kept in easy open glass bottles so the patient can get to them quickly during a heart attack. If you see nitroglycerin on the exam, remember it never gets a child-resistant cap. We also need to look back at one of the very first pharmacy laws, the Pure Food and Drug Act of 1906. Before this law, people could put whatever they wanted into a bottle and sell it as medicine, even if it was dangerous. This law made it illegal to sell fake or mislabeled drugs. It was the first time the government stepped in to make sure labels told the truth about what was inside the bottle. Another big change came with the Durham-Humphrey Amendment. This law created two separate groups of medications. It separated drugs into ones that require a doctor's prescription and ones you can buy right off the shelf. The drugs you buy off the shelf are called over-the-counter medications, like regular Tylenol or cough drops. You will also be tested on the Combat Methamphetamine Epidemic Act. This law regulates the sale of pseudoephedrine, which is a common ingredient in cold medicines like Sudafed. People were buying huge amounts of this cold medicine to illegally make dangerous street drugs. Now, pharmacies must keep these cold medicines behind the counter, even though you do not need a prescription for them. Because of this law, there are strict limits on how much pseudoephedrine a person can buy. A patient can only buy 3.6 grams of it in a single day, and only 9 grams in a whole month. As a technician, you will be the one checking the patient's driver's license and logging their purchase into a computer system to track these limits. This is a very common scenario you will face at the pharmacy counter. Finally, while federal laws apply to the whole country, each state also has its own board of pharmacy. The state board gives you your technician license and can make rules that are even stricter than the federal laws. If a state law and a federal law disagree, the pharmacy must always follow whichever law is the strictest. This is a golden rule to remember for your exam. Congratulations on completing this first section. You have done a great job learning these important rules and federal laws. To help you log this information in, I highly encourage you to take the attached practice test right now. Answering practice questions is the absolute best way to improve your memory and get ready for the real exam. This practice test is included with this lesson, so take advantage of it to keep actively learning. I will see you in the next section where we will start talking about how different drugs work. Welcome back. In this second section, we are going to explore the basics of pharmacology and medication safety. You will learn how drugs interact with the human body and how to prevent dangerous medication errors in the pharmacy. Understanding this topic is incredibly helpful because a single mistake can seriously harm a patient. Get ready, because what you learn here will make you a confident and safe pharmacy technician. Let us jump right in. First, we need to understand what pharmacology actually means. Simply put, pharmacology is the study of how drugs work inside the body to treat or prevent disease. When a patient takes a pill, it goes on a journey through their system, changing how their cells and organs behave. For your exam, Just remember that pharmacology focuses on the science of medicines and their effects on humans. Every single drug you work with will have two names, which are the generic name and the brand name. The generic name is the official scientific name of the active ingredient, and it never changes. The brand name is the trademark name chosen by the company that invented the drug. For example, ibuprofen is a generic name, while Advil and Motrin are brand names for the exact same medicine. When a doctor writes a prescription for a brand name drug, the pharmacy will usually give the patient the cheaper generic version. To do this legally, the generic drug must be exactly as safe and effective as the brand name. Pharmacists use a special government list called the Orange Book to make sure the generic is a perfect match. If you see the Orange Book on your test, know that it checks for generic equivalence. Learning thousands of drugs might seem impossible, but we make it easier by putting them into groups called drug classifications. A drug class is simply a family of medications that treat the same problem or work in the exact same way. For instance, drugs that treat high blood pressure are grouped together as antihypertensives. Learning these family groups will help you guess what a drug does even if you have never seen it before. When a patient takes a medication, they might experience side effects. A side effect is a mild, expected reaction that is annoying but not usually dangerous, like getting a dry mouth or feeling sleepy. However, an adverse drug reaction is a severe, dangerous, and unexpected response to a medication. If a patient starts having trouble breathing after taking a pill, that is a serious adverse reaction and a medical emergency. Sometimes, taking two different drugs at the same time can cause a problem called a drug interaction. This happens when one medication changes how another medication works in the body. One drug might make the other drug too strong, or it might stop it from working completely. The pharmacy computer system will usually flash a warning screen if you try to fill two drugs that interact dangerously. Drugs can also interact with the food a patient eats. A very famous example that you will likely see on your exam involves grapefruit juice. Grapefruit juice blocks the body from breaking down certain cholesterol medications, causing the drug to build up to toxic levels in the blood. Because of this, you will often need to put a warning sticker on the pill bottle telling the patient to avoid grapefruit. You also need to know the word contraindication for your exam. A contraindication is a specific situation where a drug should absolutely never be used because it will cause severe harm. For example, giving a certain acne medication to a pregnant woman is contraindicated because it causes severe birth defects. This is a hard rule, and the pharmacist will always check the patient profile to avoid these dangerous situations. Keeping patients safe means preventing medication errors, which is a major focus of your certification exam. A medication error is any preventable event that causes a patient to get the wrong drug or the wrong dose. These mistakes can happen when the doctor writes the prescription, when the pharmacy tech types it, or when the pharmacist checks it. Your goal is to catch these errors before the medicine ever leaves the pharmacy. One of the most common causes of errors involves look-alike and sound-alike drugs, which we call LASA medications. These are drugs that have very similar names but do completely different things. For example, hydroxyzine is for allergies, but hydralazine is for high blood pressure. Picking the wrong bottle off the shelf because the names look the same is a very easy mistake to make. To help prevent mixing up these similar drug names, pharmacies use a safety tool called tall man lettering. This means we write part of the drug name using capital letters to make the differences stand out. Instead of writing the names normally, the computer will print them as hydroxyzine and hydralazine. If the exam asks how to prevent look-alike errors, tall man lettering is usually the correct answer. Some drugs require even more caution, and we call these high-alert medications. These are drugs that have a very high risk of causing terrible harm or even death if they are used incorrectly. Blood thinners and insulins are common high-alert medications you will handle often. Pharmacies usually store these drugs on special shelves and require two people to double-check the dose before giving it to the patient. To ensure safety, healthcare workers always follow a checklist called the 5 Rights of Medication Administration. This means you must make sure you have the right patient, the right drug, the right dose, the right route, and the right time. Every time you fill a prescription, you are mentally checking off these 5 rights. Following this simple checklist is the best way to prevent dangerous mistakes. Let us talk about the first right, which is getting the right patient. When a patient comes to the counter to pick up their medicine, you can never just ask if their name is John. You must ask them to tell you their full name and their date of birth. Checking the date of birth is the best way to make sure you do not give medicine to a different patient who happens to have the exact same name. Another one of the 5 rights is the right route, which means how the drug actually gets into the body. Some drugs are swallowed, some are put under the tongue, and some are rubbed on the skin as creams. A common error is giving a patient an eardrop when they actually needed an eye drop. Putting an eardrop into a patient's eye can cause a lot of pain and damage. Safety also means making sure the drugs we sell are still good to use, which brings us to expiration dates. You will spend a lot of time checking the shelves and removing any bottles that are expired. If a bottle only lists a month and a year for its expiration, it means the drug is good until the very last day of that month. So, a bottle expiring in May will be safe to use until May 31st. Even with all these safety steps, human beings still make mistakes. If a medication error does happen and reaches the patient, it must be reported to national safety programs. The most common program you will hear about is called MedWatch, which is run by the FDA. Reporting these mistakes helps the government track problems and create new safety rules for all pharmacies to follow. Finally, we need to avoid using confusing abbreviations when typing prescriptions. In the past, doctors used strange symbols and short letters to save time writing, but this caused many deadly errors. The Institute for Safe Medication Practices created a list of error-prone abbreviations that we are no longer allowed to use. For example, instead of writing a simple letter U, doctors must now write out the whole word unit to avoid confusion. Congratulations on finishing this section on pharmacology basics and medication safety. You are doing a fantastic job learning how to protect patients and handle drugs carefully. Please take a moment to complete the attached practice test right now. Answering these practice questions will greatly improve your attention and get you fully ready for exam day. This practice test is included with this lesson to help you check your understanding. Keep up this great active learning, and I will see you in the next section where we cover the top medications you need to know. Welcome back to our pharmacy training. In this section, we are going to learn about the most common medications you will handle every single day. Memorizing drugs is a big part of passing your test, and knowing them helps you work much faster at the pharmacy counter. By the end of this lesson, you will know exactly how to recognize the top drugs and what they are used to treat. Let us look at some smart ways to build your mental flashcards. The easiest trick to learn thousands of drugs is to look at the end of the generic name. This ending part is called a drug stem or suffix. Drugs that are in the same family and treat the same disease will usually have the exact same ending letters. If you memorize just a few common endings, you can guess what a drug does even if it is completely new to you. Let us start with medications used to lower bad cholesterol in the blood. These drugs almost always end in the letters statin, so we call them statins. A very famous example you will definitely see on your exam is atorvastatin, which goes by the brand name Lipitor. Whenever you see a drug ending in statin, you will instantly know it is a cholesterol medication. Next, we have a group of drugs that lower high blood pressure called ACE inhibitors. You can easily spot these because their generic names always end with the letters PRIL. A perfect example is lisinopril, which is one of the most prescribed drugs in the whole country. So, if a patient brings in a prescription for a drug ending in pril, you know they are treating their blood pressure. Another common group of blood pressure and heart medications are the beta blockers. These are super easy to remember because their generic names always end in OLOL. Metoprolol is a beta blocker you will fill all the time in the pharmacy. Just remember that the OLOL ending means it helps the heart beat slower and reduces the workload on the heart. A third type of blood pressure medication is called a calcium channel blocker. These drugs relax the blood vessels so the heart does not have to push as hard, and they mostly end in dipine. Amlodipine is a huge seller in this category. For your test, tie the dipine ending directly to relaxing blood vessels for better blood flow. If a patient has bad heartburn or acid reflux, they will probably take a proton pump inhibitor. The generic names for these stomach drugs usually end in PRA to ZOLE. A great example is omeprazole, which you might know by its brand name Prilosec. When you see that prazole ending, think about calming an upset stomach and stopping acid. Now let us talk about drugs that treat depression and severe sadness, which are often called SSRIs. Two very common ones you need to memorize are fluoxetine, which is Prozac, and sertraline, which is Zoloft. These medications help balance the chemicals in the brain to make a person feel better. Patients usually take these once a day, and it can take a few weeks before they start working. For patients dealing with high anxiety or panic attacks, doctors often prescribe benzodiazepines. You can spot these because they mostly end in PAM or LAM, like alprazolam or diazepam. Remember from our law section that these are Schedule 4 controlled substances. They can be slightly addictive and cause a lot of sleepiness, so patients should not drive after taking them. Moving on to pain relief, you will handle many prescriptions for NSAIDs, which stands for non-steroidal anti-inflammatory drugs. Ibuprofen and naproxen are common NSAIDs that reduce swelling and lower fevers. A big exam tip is that NSAIDs can be very hard on the stomach and even cause bleeding. You should always suggest that patients take these pills with a full meal to protect their stomachs. When patients have severe pain from a surgery or a broken bone, they need stronger painkillers called opioids. Drugs like hydrocodone and oxycodone belong to this group. As we learned earlier, these are Schedule 2 controlled substances because they have a very high risk of addiction. You will need to count these pills twice and lock them in a special safe to prevent anyone from stealing them. You will also fill many prescriptions for antibiotics to treat bacterial infections. The oldest family of antibiotics is the penicillins, and their generic names simply end in cillin. Amoxicillin is the most popular one, especially the pink liquid version given to kids for ear infections. A huge warning for your exam is that many people are highly allergic to penicillins, so you always need to ask patients about their allergies. Another group of antibiotics is the cephalosporins, which always start with the letters CEF or CEPH. An example is cephalexin, which is also called Caflex. A very common test question asks what happens if a patient is allergic to penicillin and takes a cephalosporin. Because these two drug families are very similar, the patient might have an allergic reaction to this drug too, which is called cross-sensitivity. A third family of antibiotics you need to know are the macrolides, which usually end in THROMYCIN. The most famous one is azithromycin, commonly known as AZ-Pak. These are often used for chest infections or strep throat. Patients love the Z-Pak because they usually only have to take it for 5 days, while other antibiotics take a full 10 days. Diabetes is a huge health problem, so you will see many medications to help control high blood sugar. The most common starting pill for type 2 diabetes is called metformin. It works by telling the liver to stop making so much extra sugar. Metformin is very safe, but a common side effect is a bad stomach ache when a patient first starts taking it. For patients whose diabetes is harder to control, they might need to use insulin injections. Insulin is considered a high alert medication because giving too much can cause a patient's blood sugar to drop to deadly levels. In the pharmacy, you must always store unopened boxes of insulin in the refrigerator. However, once the patient takes it home and opens it, they can keep it at room temperature for about a month. Asthma is another common disease where patients use small inhalers to help them breathe. Albuterol is a very famous inhaler used for sudden asthma attacks to open up the lungs quickly. We call this a rescue inhaler because it saves them in an emergency. Patients should carry their albuterol rescue inhaler with them everywhere they go. For seasonal allergies, patients will take antihistamines to stop their runny noses and sneezing. Diphenhydramine, which is the generic name for Benadryl, is very strong but causes extreme sleepiness. A newer allergy pill is cetirizine, known as Zyrtec, which works great without making the patient quite as tired. You will find most of these in the over-the-counter aisle, but doctors still write prescriptions for them. To study all these drugs, creating simple flashcards is your best tool. On the front of the card, write the brand name and the generic name. On the back, write the drug class, what it treats, and one special warning or side effect. Reviewing just 20 flashcards a day will quickly build your knowledge and make the real test feel very easy. Congratulations on finishing this third section. You have learned an impressive amount about the top medications and how to identify them safely. I strongly encourage you to take the attached practice test right now. Answering practice questions greatly improves your long-term retention and gets you perfectly ready for the exam. This practice test is included with this lesson to build your confidence. Keep up your active learning, and I will see you in the next section where we will tackle pharmacy math in a very easy way. Welcome back. In this fourth section, we will tackle pharmacy math and calculations. I know math can seem a bit scary, but I promise we will make it very simple. Learning these basic formulas is a huge part of your job because giving the wrong amount of medicine is dangerous. We will break everything down step by step so you feel totally confident. Let us get started and conquer this math together. The very first thing we need to understand is how we measure things in the pharmacy. We mostly use the metric system, which measures weight in grams and liquids in liters. You will also see the household system, which uses things like teaspoons and tablespoons. To pass your exam, you must know how to switch between these two different systems easily. Let us start with the most common metric conversion, which is changing grams into milligrams. 1 gram is exactly equal to 1000 milligrams. If a doctor orders 2 grams of an antibiotic, you just multiply 2 by 1000 to get 2000 milligrams. To change it back the other way, you just divide by 1000. The exact same rule applies when we measure liquids. 1 liter is always equal to 1000 milliliters. If you have a 2-liter bottle of normal saline for an IV bag, that is the same as 2000 milliliters. Remembering the number 1000 is the magic key for almost all metric conversions. Now we need to translate the household system into the metric system. The most important conversion you will ever learn is the teaspoon. 1 standard teaspoon holds exactly 5 milliliters of liquid. So, if a prescription tells a mother to give her child 1 teaspoon of cough syrup, you know she will give exactly 5 milliliters. Next up is the tablespoon, which is much bigger than a teaspoon. 1 tablespoon holds exactly 15 milliliters of liquid. You can also think of this as 3 teaspoons put together. If a doctor tells a patient to take 1 tablespoon of stomach medicine, they will be swallowing 15 milliliters. Sometimes, large bottles of liquid medicine are measured in ounces. You need to memorize that 1 fluid ounce is equal to exactly 30 milliliters. If a bottle holds 4 ounces of liquid, you just multiply 4 by 30 to find out that the bottle contains 120 milliliters total. This is very helpful when figuring out how long a bottle will last. You also need to know how to measure a patient's weight, especially for kids, because their doses are based on how heavy they are. The conversion you need is that 1 kilogram equals 2.2 pounds. To change a patient's weight from pounds to kilograms, you simply take their weight in pounds and divide it by 2.2. Let us look at a quick example of changing weight. If a patient weighs 44 pounds, you take 44 and divide it by 2.2. That gives you 20 kilograms exactly. Always remember to divide when going from pounds to kilograms, because the number in kilograms should always be smaller than the number in pounds. One of your main jobs at the computer will be calculating days' supply. This simply means figuring out how many days a prescription will last before the patient runs out of medicine. Insurance companies will only pay if this number is exactly right. To find it, you just take the total number of pills given and divide it by the number of pills the patient takes each day. Here is an easy example of days' supply. If a doctor prescribes 30 pills and tells the patient to take 1 pill a day, that is obviously a 30-day supply. But if the doctor says to take 1 pill twice a day, the patient is using 2 pills daily. You divide 30 by 2, which means the bottle will only last 15 days. Calculating days' supply for liquids is just a little bit harder. First, you have to figure out the total amount of liquid in milliliters. Then, you figure out how many milliliters the patient takes every single day. Finally, you divide the total volume by the daily amount to find out how many days the bottle will last. Let us pretend a patient gets a 150 milliliter bottle of cough syrup. The instructions say to take 1 teaspoon twice a day. Since 1 teaspoon is 5 milliliters, taking it twice a day means they use 10 milliliters every day. You divide 150 by 10, giving you a 15-day supply. Sometimes the math works backward. and you have to figure out how many pills to put in the bottle. We call this finding the quantity to dispense. To do this, you multiply the number of pills the patient takes every day by the total number of days the doctor wants them to have medicine. For example, a doctor writes a prescription for a pain pill to be taken 3 times a day for 7 days. You simply multiply 3 by 7. This tells you that you need to count out exactly 21 pills to put in the bottle. It is a very simple multiplication step that you will use constantly. When you work with eye drops or ear drops, the math gets interesting because we measure them in actual drops. For the exam, the standard rule is that 1 milliliter of liquid contains 20 drops. So, a small 5 milliliter bottle of eye drops contains about 100 drops total. You use this math to figure out how long the tiny bottle will last. You might also have to switch between Fahrenheit and Celsius temperatures, mostly to check the pharmacy refrigerator. The easiest formula to remember involves the numbers 9, 5, and 32. I recommend memorizing that 0 degrees Celsius is the same as 32 degrees Fahrenheit, which is the exact freezing point of water. Finally, doctors still use Roman numerals to tell you how many pills to dispense or how many refills a patient gets. You need to know the basic letters used in pharmacy. A capital I equals 1, a V equals 5, and an X equals 10. If you see the letter L, that means 50, and AC means 100. If a prescription has the Roman numeral XXX on it, that means 10 plus 10 plus 10, so you will dispense 30 pills. If it says 24, the X is 10, the second X is 10, and the IV is 4, making 24. Reading these letters correctly stops you from making very bad counting errors. Congratulations on finishing this section on pharmacy math and calculations. You have done an amazing job learning these formulas, and I know you will use them perfectly on the job. Right now, I want you to practice what you learned by taking the attached practice test. Solving practice questions is the smartest way to improve your retention and lock in your exam readiness. The practice test is included with this lesson to give you hands-on experience. Keep up your active learning, and I will see you in the next section where we process prescription orders. Welcome back. In this 5th section, we are going to walk through exactly what happens when a patient brings a prescription to the pharmacy counter. You will learn how to read doctor's handwriting, enter the information into the computer, and handle insurance billing smoothly. Understanding this process is very important because it is what you will be doing for most of your shift. Get ready to learn the exact steps that turn a piece of paper into safe medication for a patient. The process starts at the drop-off window. When a patient hands you a prescription, your first job is to make sure all the right information is actually on the paper. A legal prescription must always have the patient's full name, their date of birth, and the date the doctor wrote the order. If the doctor forgot to write the date, the prescription is not legal, and you cannot fill it. You also need to look at the doctor's information on the paper. The prescription must have the doctor's name, their office address, and their phone number. This is so the pharmacist can call them if there is a problem or a question about the medicine. The doctor must also sign the bottom of the paper by hand, just like signing a check. Reading a doctor's handwriting can feel like trying to read a secret code. Doctors use special abbreviations called SIG codes to tell you how the patient should take the medicine. These codes come from old Latin words, but you will memorize the English meanings very quickly. Learning these SIG codes is a massive part of passing your pharmacy technician exam. Let us learn some of the most common SIG codes right now. If you see the letter B combined with I and D, that means the patient should take the medicine twice a day. If you see TID, it means 3 times a day, and QID means 4 times a day. You will type these letters into the computer, and the computer will automatically translate them into full English words for the patient's bottle. There are also codes for when the patient should take their medicine. The letter combination AC means to take it before meals, while PC means to take it after meals. If a doctor writes HS on the prescription, it means the medicine should be taken right at bedtime. Knowing these timing codes helps the patient take their medicine safely. Doctors also use codes to tell you which part of the body the medicine goes into. If you see the letters PO, that means the medicine should be swallowed by mouth. But if you see the letters PR, it means the medicine is a suppository that goes into the rectum. Mixing those two up would be a terrible mistake, so you have to read the codes very carefully. We also have specific codes for eyes and ears, and these show up on the exam all the time. The letter A stands for ear, and the letter O stands for eye. Then, we add a second letter for left or right. The letter D means right, the letter S means left, and the letter U means both. So, if you see the code OD, you know O is eye and D is right, which means the right eye. If you see AS, A is ear and S is left, meaning the left ear. If a doctor wants drops in both eyes, they will write OU. A great trick is to remember that the letter U stands for universal, meaning both sides. Once you read the prescription, you have to enter it into the pharmacy computer system. This step is called order entry. You will search for the patient's name and type in the drug name, the strength, and the directions you just translated. You must type everything perfectly because a simple typo can cause a dangerous medication error. After you type the order, the computer will automatically send it to the patient's insurance company. This process is called adjudication. It only takes a few seconds, but the computer is actually talking to the insurance company to see if they will pay for the drug. The insurance company will either send back an approval or a rejection. If the insurance company approves it, they will tell you exactly how much the patient owes. This amount is called a copay. The copay is simply the portion of the medicine's cost that the patient has to pay out of their own pocket. You will collect the copay when the patient comes back to the register to pick up their medicine. Sometimes, the insurance company will reject the claim and refuse to pay. When this happens, the computer screen will show a rejection code. A very common rejection code says refill too soon. This means the patient is trying to get more medicine before their current bottle should be empty, and the insurance will not pay for it yet. Another common insurance issue is called prior authorization. This means the doctor prescribed a very expensive drug, and the insurance company wants the doctor to explain why the patient needs it. When you see a prior authorization message, you have to fax the doctor's office and let them handle it. The patient cannot get their medicine until the doctor and the insurance company sort it out. Let us switch gears and talk about making special medicines, which is called compounding. Sometimes a patient needs a medicine that does not come pre-made from a factory. For example, a baby might need a heart medication, but it only comes in large pills for adults. A pharmacy technician will have to crush the pills and mix them into a sweet liquid so the baby can drink it. Making that liquid is called non-sterile compounding. You do not need a perfectly clean room for this, but you do need special tools. You will use a heavy bowl called a mortar and a grinding tool called a pestle to crush the pills into a fine powder. Then, you use a flat glass board and a special spatula to mix the powder into creams or liquids. There is also a much stricter type of mixing called sterile compounding. This is used when you are making medicines that go directly into a patient's veins, like IV bags in a hospital. Because these medicines go straight into the blood, they cannot have any germs or bacteria in them at all. You have to make these inside a special glass hood that filters the air. When you do sterile compounding, you must wear special protective clothing to keep your germs away from the medicine. You will wear a hairnet, a face mask, a gown, and sterile gloves. Putting all these items on in the exact right order is called garbing. Your exam will definitely ask you about the proper steps for hand washing and garbing before making an IV bag. Before any medicine leaves the pharmacy, whether it is a normal pill or a compounded liquid, the pharmacist must do a final check. They will look at the original prescription, the medicine you picked, and the label you printed. As a technician, your job is to prepare everything perfectly so the pharmacist can approve it quickly and safely. Congratulations on completing this section. You are learning incredible things about order entry and how we process prescriptions safely. I really encourage you to complete the attached practice test right now. Doing practice questions is a fantastic way to improve your retention and make sure you are ready for the exam. This practice test is included with this lesson to help you build your skills. Keep up your active learning, and I will see you in the final section where we review advanced practices. Welcome to the final section of our course. You have made it so far, and I am incredibly proud of your progress. In this lesson, we will cover advanced pharmacy practices and wrap up with a complete exam review. Understanding these final concepts connects your basic knowledge to real-world hospital work and gives you the confidence you need for test day. Let us finish strong and get you completely ready for your certification. First, we need to talk about the difference between working in a retail pharmacy and a hospital pharmacy. Retail pharmacies are the ones you see in your neighborhood, where patients walk in to pick up pills in small bottles. Hospital pharmacies are very different because the patients are staying in beds upstairs. In a hospital setting, you will prepare IV bags, fill medication carts, and deliver drugs directly to the nursing floors. In a hospital, doctors write medication orders instead of normal prescriptions. A medication order tells the pharmacy exactly what the patient needs right now while they're in their bed. These orders are sent straight to the pharmacy computer system from the patient's room. You have to fill these orders very quickly, especially if the doctors are dealing with an emergency situation. Hospital pharmacies use a system called unit dose packaging. Instead of counting 30 pills into one large bottle, each individual pill is sealed in its own tiny wrapper with a barcode on it. This makes it incredibly easy for the nurses to scan the pill before they give it to the patient. Unit dose packaging is a major way hospitals track inventory and prevent medication errors. You will also learn to use automated dispensing machines. These are large computer cabinets sitting on the nursing floors, kind of like secure medical vending machines. The pharmacy technician fills these cabinets with the unit dose pills every single morning. When a nurse needs a drug, they type their password into the cabinet, and the exact drawer opens for them automatically. Now let us look at inventory management, which is how we handle all the boxes of drugs on our shelves. A huge part of your job is keeping track of what comes in and what goes out. The goal is to always have enough medicine for patients without keeping too much extra stock in the back room. Too much extra stock costs the pharmacy a lot of money and takes up valuable space. To manage inventory smoothly, most pharmacies use a system called par levels. A par level is the minimum amount of a drug you want to keep on the shelf at all times. If you set the par level for ibuprofen at 5 bottles, the computer will automatically order more ibuprofen when you drop down to 4 bottles. This system does the math for you and keeps the shelves full without overspending. You also need to know about stock rotation and the rule of first in, first out. When a new delivery of medicine arrives, you never put the new bottles right in front of the old bottles. You always push the older bottles to the very front of the shelf so they get used up first. This simple trick prevents your medicine from expiring before you have a chance to sell it. Sometimes, a drug company discovers a problem with a medicine and issues a drug recall. There are 3 types of recalls you must know for your test. A Class 1 recall is the most dangerous, meaning the drug could cause severe health problems or death. If a Class 1 recall happens, you have to immediately pull the drug from the shelf and help call the patients who already bought it. A Class 2 recall means the drug might cause a temporary health problem, but it is not likely to be deadly. A Class 3 recall is the least serious level. This usually means there is a minor problem, like a typo on the outside of the box, but the medicine inside is perfectly safe to take. Knowing the difference between these 3 classes will definitely earn you points on the exam. Another big topic is quality assurance. This means having strong rules in place to make sure every single prescription is filled perfectly every single time. Quality assurance is all about catching your own mistakes before they ever happen. This is exactly why you double-check the drug name on the bottle against the drug name on the computer screen before moving forward. A major part of quality assurance is handling patient complaints correctly. If a patient calls and says their pills look different than last month, you must stop and investigate immediately. Sometimes the factory just changed the color of the pill, which is perfectly fine. But other times, it means you accidentally put the wrong medicine in their bottle, and you need to fix it right away. As we move into our exam review, I want to share my best strategies for test day. When you sit down at the computer to take your test, read every single question twice. The test makers love to hide tiny words like not, or, except, right in the middle of a sentence. Missing one small word can completely change the answer you need to choose. If you do not know the answer to a question, use the process of elimination. Look at the 4 choices and cross out the ones you know are definitely wrong. Even if you just get rid of 2 bad choices, you have deeply increased your chances of guessing the right answer. Never leave a question blank on this test, because a guess can still earn you points. Pay special attention to questions about pharmacy math and conversions. You will be given a basic calculator on the computer screen to help you out. Always write down your math steps on the scratch paper they provide. Doing the math strictly in your head is a very fast way to make a simple mistake when you are feeling nervous. Remember to lean on the drug suffixes we learned in the flashcard section. If a question asks about a drug you have never seen before, look at the very end of the word. If it ends in statin, you automatically know it is for cholesterol. Trusting those simple word endings will save you when you feel stuck on a strange drug name. Also, rely heavily on your knowledge of federal laws. The exam will definitely ask you about the schedules of controlled substances. Remember that Schedule 2 drugs need physical prescriptions and can never be refilled. Remembering these hard legal rules will help you quickly find the correct answer in tricky scenario questions. Take your time during the test and do not let the clock make you panic. You will have plenty of time to finish all of the questions. If you are stuck on a really hard question, just flag it and move on to the next one. You can always come back and look at the flagged questions with fresh eyes before you submit your final test. Trust in the training you have completed with me. You now know how to follow federal laws, calculate complex math, handle top medications, and process orders safely. You understand the differences between retail and hospital settings, and how to manage pharmacy inventory. You have built a massive foundation of knowledge that makes you a highly capable pharmacy technician. Congratulations on completing this final section and finishing the entire course. You have put in the hard work, and you are totally ready to pass your certification exam. To lock in everything we just reviewed, please complete the attached practice test right now. Working through practice questions improves your long-term retention and guarantees your exam readiness. This final practice test is included with this lesson to give you the ultimate advantage. Keep up your active learning, believe in yourself, and go ace that exam.